So the Tobacco Dependency Treatment Service started in 2021 at UHL. This was a service funded through the NHS long-term plan. And the idea was to identify all people who smoke who are admitted as inpatients to UHL, or all people who are pregnant who smoke, and make sure that we offer them treatment for tobacco addiction on admission. And that stopping smoking will prevent a whole bunch of diseases, whether that's chest infections, heart attacks, strokes, and several other diseases that I see in my lung cancer clinic, my respiratory clinics, and in the intensive care unit. And the really fantastic thing about this treatment pathway is that it starts in a hospital and it continues for 12 weeks in the community.
Big part of my role is training NHS staff about cure and their involvement and the necessity for them to be supporting their patients who are smokers. So the idea is if we can prevent ill health by helping people to stop smoking, and actually stopping smoking is the most cost-effective health intervention the NHS can make, we are going to help reduce readmissions, we are going to increase smoking quit rates, and we were going to reduce mortality rates and improve the health of the population of Leicester and Leicestershire.
Most patients do like to have some nicotine replacement, but more importantly than that, they like to be listened to and, help us to share some strategies to support them in the longer term, and make some adaptations necessary to complete a successful quit attempt. Getting the tools to help a smoker stop smoking is probably one of the most important things that you can do because of what it could eventually prevent.
I think it's really great because the more we educate, more we talk about giving up smoking, I think people will try to do their best and make efforts to give up. And then when we see a lot of people giving up smoking, that makes you feel really proud.
We're a really busy service. We receive between 700 to 800 referrals a month, but we're a really small team. We don't get to see all of those patients, unfortunately. But that just sort of reinforces the need and the importance of the training to the staff who are here 7 days a week to engage with those smokers, to have that very brief advice and get them started on some nicotine replacement medications and start their quit journey. And we have put them on the path to a smoke-free future, and they are really grateful, and that's worth so much.
So UHL is at the forefront of prevention in hospitals in the Midlands. We've implemented lots of different elements of the NHS long-term plan. We've implemented a tobacco dependency treatment service at UHL, and we've seen over 3,000 patients since we started. More recently, we've also offered our staff, who are our greatest asset, treatments for things like tobacco dependency, and we'd also like to now promote the service to treat people for unhealthy weight, who are members of our staff using the new NHS digital weight management programme, and we hope to do more with this in the coming year. The importance of this has been described in things like the Hewitt Review, which describes that we've got to move from just treating the emergencies and ill health to preventing ill health and improving the health of our population to reduce demand and to allow people to live healthier lives for longer. And that's why I'm proud about the Tobacco Dependency Treatment Service and our new alcohol care teams.